Have any one of you ever got admitted in a hospital on your birthday in a critical stage? Yes, I'm going to talk about it. How for 18 days I struggled to beat the COVID-19. Hi there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital, and today I'm going to give you day-by-day account how I survived COVID. There are people who talk about second innings. Ain't I lucky? Just imagine. I'm going to tell you about my third innings. 2019, 5th of June, I had a massive heart attack when I was abroad, and the cardiologist said that if I had not reached the hospital emergency within another 10-15 minutes, I would have kicked the bucket. Yes, I had an emergency angioplasty, 2 stents put inside my heart, and I survived and I made it. And then I felt, yes, now I'm going to start my second innings. And now what happened? 25th of October, I was detected with COVID-19. Now, most of us get this feel that nothing will happen to me. Because why? People talk about percentage. 85% of the people are asymptomatic. Only probably 15% needs hospitalization. Probably around 5% get into ITU, and the mortality rate is now 0.5 to 1%. Who cares about the percentage? The campus where I live in, the compound, 4 people have expired from COVID-19, and I'm still struggling to convince the people, man, if you're getting into the lift, wear a mask. And today I want to share my feeling, how it feels when you can get that feeling of impending doom. Man, will you make it? Or is this the end? No, I wasn't careless. I read up everything about COVID-19. When we started working, yes, this is the way I do my chamber, with full PPE, protection kit, with face mask, with everything else. How do we operate? We check every patient with double COVID test, and we put full PPE and then operate. Sanitizing, wearing mask. But still, yes, my first symptom was I started coughing, fever. I did not neglect it. Straight away went for a COVID test. So let's take from there. 25th of October, I did the RT-PCR. It came positive. Consulted a doctor, and like many other people feel that nothing will happen to me, I also thought, yes, I'm in home quarantine. But what are the things which are called comorbidity? So who are the people who are doing well? And that's the time, as a doctor, you start looking up literature. Everybody says that don't read so much. So what did I do? Consulted a chest physician. Immediately went and followed each and every medication that has been advised. Did not try to treat myself. Was in home quarantine. You know what quarantine in a flat means? बाहर से कोई अंदर ना आ सके, अंदर से कोई बाहर ना जा सके. 31st October in the night, my cough started getting bad. I was continuously doing my oxygen saturation through pulse oximeter, taking temperature, and when the oxygen saturation started going down, that was the 31st night I got scared. I got an oxygen cylinder from the hospital. I used oxygen in the night and then somehow managed to reach my saturation. The warning signal is, among all other things, keep and watch on oxygen saturation. If it goes below 94, 95, please immediately get in touch with a doctor to get plan for hospitalization. So 1st November, my birthday, no cake cutting, no celebration. That's the time when I realized that I think I'm in trouble. So I went and got a HRCT, a chest CT, and that was bad. I already got patches with COVID-19 viral pneumonia. Immediately got admitted in a hospital where they are specialized in COVID-19 treatment. So during this phase, when you are in home quarantine, there are certain things which are followed. One is usually you are started with a steroid, because basically what it does is COVID-19 sets up an actually immunological reactions in your respiratory tract and lung tissues. So a dose of steroid oral tablets is started. An anticoagulant is started, which is Xarelto or rivaroxicam. I'm not going into the details of the doses because you're not supposed to decide on that. Doctor will do. And there is another tablet called Scavista or ivermectin. This is a medicine which is used for parasitic infection, but this improves your immunity. So this is all added with vitamin C and also multivitamin, that is B complex. Good food, nutritional food, take rest and be at home. And that's provided if all goes well. But it did not happen in that way for me because the CT looked bad, now the aggressive treatment. So I was shifted into HDU, high dependency unit. Now no longer low dose steroid. It is prednisolone 60 milligrams 3 times daily through IV channel. So that's about 180 milligrams of steroid prednisolone. Normally when you get an allergic reactions, we usually give only 5 milligrams. And I was on 180 milligrams of prednisolone per day. Anticoagulant no longer in terms of tablet. I was on low dose heparin, which is called enoxaparin, injection every day in my tummy. I was on intravenous antibiotics and also remdesivir, which is the drug which is given intravenously to combat COVID-19. And along with that, to maintain your oxygen saturation, I was in 4 to 6 liters of oxygen continuously for 9 days in high dependency unit. I want you to feel how it is. I want you to feel that you do not know where this will lead to. I can see through the glass that people were coming and going out. I could see people who were deteriorating in front of me. Each and every caregiver who were coming inside in full PPE, you can't even recognize who are these people. For 9 days, I could not see any of my own people because it is a restricted area. And just to let you know, ECG leads connected to the monitor. Pulse oximeter, and I can see that my oxygen saturation, my oxygen requirement increasing. And that's the time when I'm thinking, will I need ventilation? Will I go into artificial respiratory support? And the next thing is, if your lungs become so badly involved that it can't oxygen anymore, then you will go into ECMO. People probably feel, what are all this? Once the lungs get stiffened, which is ARDS, acute respiratory distress syndrome type of picture, or white lung, when it is just lung is become white, that's the time when it can't oxygenate anymore. It's extracorporeal membrane oxygenator. Like a heart-lung machine, you have an ECMO machine where the blood is passed through to oxygenate and give it back to you. This is what I was going through. Every day I wake up in the morning and I will do a video.
Good morning, everybody. No, I haven't lost my mind. I remember the days. Today is the 12th day of my COVID posting. I'm in HDU, high dependency unit, on a nasal catheter with 4 to 6 liters of oxygen per minute. Yes, I survived another day. Now I'm taking day by day because I'm going to fight and teach this virus a lesson.
Just to convince myself, just to tell and boost my confidence, man, I'm going to teach this virus a lesson. You have entered the wrong body. I shall not give up. I shall not give in, but I will fight. Just to let you know, with oxygen support, I could maintain 93, 94. And if I actually went to the washroom from my bed, my oxygen saturation were dropping nearly up to 80%. I was breathless even to go from my bed to the washroom. Why is it that still we have get-together parties, birthday parties and weddings now and people don't care to wear masks? I don't want to burden people with the number of deaths that our country has faced. More than 500 doctors have expired in India. So many healthcare people have expired. Have we learned a lesson from this? I wanted to share this, that twice I have faced these situations. Why we are not able to be prophylactic. When I had the heart attack, I decided that why can't I convince people to take care of your heart? Now when I had the COVID infection and I felt that I need to tell people, it's very easy, everybody talk about social distancing, hand washing and mask. Yes, these are important because the virus can only enter through your mouth, nose and eyes. If you don't touch your hands to your face, you can stop it. But even that you people are not ready to do. Talking about food, because this is the time when you lose your sense of smell and lose your sense of taste. If there is anybody, even no fever, no cough, nothing, if a person says that I can't smell the perfume and it's burning inside the nose, that's definitely probably COVID positive, because this virus damages the nerve endings and that's why it causes burning sensation, and after that you lose your sense of smell. So if you can't smell, if you can't taste, you won't feel like eating. Anyway, you have got fever. But how are you going to fight the virus? Where is your body resistance and immunity? So food has to be considered as if it is medicine. So this is the time when not junk food. This is the time when nutritional food. This is the time when you have to take vitamin C, lemon. This is the time when you have to take protein diet, chicken, fish. This is the time when you have to hydrate yourself. Take lots of water or juice. This is the time when you have to take things which boost your immunity. Yes, there are several things which are considered. One can have healthy milk, ashwagandha, and also ivermectin, which is actually boosting the immunity. Now, if you actually take care of all these aspects, then you will be able to fight COVID. And I want only one message to go. The reason I'm talking over here today, that the people who have gone that close and come back, we want to make one request to the mass. Don't touch your hand in your face. Every time, even if you want to remove your mask, wash your hand with sanitizer. This is the only way the virus can enter. If we just be careful, that's it, we can win. I did that. I came back. But please continue the next episode. It's not just winning COVID. It's the post-COVID complications. where people are just dropping dead with viral myocarditis, where people are having intracerebral hemorrhage, where people are having acute abdomen and gangrene gut, and they're not even reaching the hospital. Last week, as I talk now, 2 doctors, young, below 40, one ophthalmologist and one urologist, just dropped dead after recovering from COVID. So please, let's fight the disease. Let's follow the instructions. Mujhe kuch nahi hoga. I'm fine. Don't develop this attitude. COVID-19 do not recognize who you are. So please, mask, sanitization, and don't touch your finger to your face. And let's not talk about social distancing. The word we were talking about, physical distancing. What else do we sanitize other than our hand? There is something which we are holding it all the time, because in today's time we can't stay without the phone. The phone is the biggest source. We don't sanitize the phone properly. So what are the things that you can do? You can use a headphone. You can use a Bluetooth. You can put the phone on loudspeaker. Don't bring your phone and all the time bring it near your face. So it's not only your fingers which you shouldn't touch the face. Don't bring your phone without sanitizing and touch your face. Stay safe. Follow the hygiene. Follow the instructions that have been given. Like, share, and subscribe to this channel. Let's fight COVID. I came back after 9 days from intensive care unit. You all can do it. But for that, yes, we need to follow everything. Thank you very much for watching.